Welcome. This is now video number 2. The first one talked about the color of the teeth. In this video, we're going to be talking about the position of the teeth. Remember, we're talking about the 4 parts of cosmetic dentistry. We're talking about the color, the position, the shape, and the quantity or number of teeth. And the reason why all these different things are important is if you're interested in getting your smile improved, we have to kind of know what things need to be corrected. So today we're going to be talking about the position of the teeth. When you think about the position of teeth, first thing comes into a lot of people's minds is either crowding or spacing. So here's an example of teeth that are just crowded. You know, we like to have the teeth in a nice, smooth kind of arch that goes from left to right, out to the front and goes to the back, that the teeth are all just kind of lined up next to each other. But when the teeth get kind of bumped into each other and get crowded, then it kind of throws off the smile. And a little bit of crowding sometimes isn't that big of a deal, but the more crowded the teeth become, then it starts to detract from the smile. So that's an example of someone who has crowded teeth. Here's an example of people who have spaces between their teeth. You've probably seen this a lot. And this is a very easy fix. We'll talk about the fixes here in just a moment. But there's also a position of the teeth where there is some spacing. Can also have some vertical components. You know, with the crowding, it was more of a horizontal issue where they're either being too crowded or too spaced. But we can have some vertical issues as well. Maybe the teeth are coming down too far, or maybe they're pushed up too high. And this could be a function of not just the teeth, it could be the jaw bone itself, or maybe they reveal too much of the teeth because the lip goes up too high. But there's a vertical component that we look at as well when we're looking at someone's smile. Next, we may have the gum tissue could be not in the right position. We talked about the teeth not in the right spot, but in this individual, you can see the teeth are lined up pretty well. It's just as we go along and then all of a sudden the gum tissue goes up. So there's a positional problem with the gums. Next, we might have the angulation of the teeth. For example, these teeth, not only are they crowded, but they're kind of going in different directions. You notice in this slide, I've got the lines kind of showing what direction the teeth are actually going in, and we don't like them going this way and that way. We like to have them vertical. Can we hear this in the background?
I'm not sure.
What the world? Every time. Okay, let me go back up here. We'll start with the angulation. Or what we might run into is somebody who has an angulation problem. That means that the teeth, not only might be crowded, but they are just kind of tilting in the wrong direction. So in this case, I took these black lines and drew them through the kind of the long axis of the teeth. And we like to have these teeth just kind of line up like this. They may not be straight up and down like picket fences, but they're going to be kind of converging slightly towards the middle. And in this case, they're kind of going different directions. The blue dots actually show where the crest of the tooth is, or where the gum line arcs at the highest. And that should have some symmetry as we start from the front and work away from front to back. And so here you can kind of see the position of them is just kind of scattered throughout. We also might have teeth that are tipped too far in, like this individual. We can see that his front teeth right here, those guys are tipped in towards the lip or towards the tongue. And then he has these small guys here on the outside, and those guys are flipped outward. And then the bottom picture, you can just kind of tell that person has like that buck tooth look where the front 2 teeth are just flared out too far. Again, this is a position problem. Another thing of flared out or tipped in. And so how do we fix that? I think everyone kind of knows what the answer is. It's going to be some type of orthodontic treatment. It's going to be moving the teeth into the right spot. And so there's 2 main ways of doing that. You can do braces, which has been around forever. Everyone knows that. You're going to have to wear brackets on the teeth and put wire in there that kind of helps move the teeth around. There's also a thing called Invisalign, or clear aligner therapy. And what this is are clear trays that you put in. And there's a whole series of trays that you would wear over the course of several months, maybe up to a year or so. And they would move the teeth into the right spot. I'd have to say traditionally, most dentists would lean towards doing braces on somebody who's in their young teenage years, maybe even their later teenage years, but as we get older and older, there seems to be more of a transition into doing something like the clear aligner therapy or Invisalign. Of course, there are extenuating circumstances that may allow or disallow either one of those treatments, but that's generally how that works out. So both of those can work really well in most cases. Again, this is something to talk about with your dentist or maybe orthodontist about getting the teeth into the right position. So that is part 2 of this 4-part series on how we get a better cosmetic smile. Thank you.